Welcome to this week's NIB News Update.
From the very inception, physicians have played a key role in the development of the National Prescription Drug Plan. Now that the plan has been up and running for more than a month, physicians are talking about its impact on their patients.
I feel the drug plan is going exceptionally well. Patients seem to be satisfied. They're very happy with the fact that they can go to multiple locations to pick up their medications, and it reduces their wait time. And so I'm excited. I'm excited about what's happening.
Well, in a nutshell, it's gone extremely well. I think the reception has been probably even better than we would have anticipated. Most people have greeted the plan with a lot of enthusiasm. Just on Friday, I had a patient that was here, and she was telling me how much she had saved this month with all of her different medications.
I think it's going rather well. I feel a lot more comfortable now knowing that my patients can get their medication at the time that, they can have it, and that they're not going to run out of it because of financial coverage. There's been just a little bit of challenge in terms of persons knowing that they may have to switch certain medications based on the ones that's on the plan. Haven't had too much of a problem in terms of them understanding that, and I think they also realize the importance of having the medication on a regular basis and the fact that it is a financial advantage for them now that they have the drug plan.
The doctor said patients are delighted that the drug plan is reducing the cost of their prescription drugs and medical supplies.
The people that I see tend to be hypertensive, diabetic, patients with heart disease. So you're talking about patients who have 2 or 3 drugs for high blood pressure and 1 or 2 drugs for diabetes and a cholesterol drug and so on. So by the time as they go to the pharmacy, if they were going to a private pharmacy, they could walk out with a $500-600 a month bill for medications.
I think especially in these hard economic times, a lot of patients are very appreciative of the initiative that NIB has taken to allow them to get their medications. It's been a tremendous decrease in burden for patients and their families, and I'm just excited about the plan being extended even further for patient care.
In some cases, physicians said they are adjusting the medicine prescribed for their patients.
Just last week, I've had to alter some of the medications. As you begin to make decisions, it's all well and good to say that, I want a particular drug and I like this drug because I've been taking this for so many years. But when you give somebody the option, well, we could save you another $80 a month. Boy, that sounds good. This doesn't eliminate the need for care from a compassionate, caring, capable physician. So as before, if you're having issues with the medicines that you're taking, or if you're having medical problems, this still requires that you see your physician on a regular basis, because all drugs have side effects, every single one of them.
Particularly as it relates to blood pressure or even diabetes, I like to bring them back in short order within a 2-week, 4-week period to ensure that their disease is still under control and it hasn't changed. So I've been doing that. I've been giving them follow-ups so that I can ensure that they're still being controlled.
Overall, the doctors are optimistic that the drug plan will lead to increased compliance and better health for their patients.
There are many people who mean to take their medication. They have every intention, but quite frankly, they simply cannot afford to do so. So this plan now takes that horrible choice that people in this country have to make, some people on a daily basis, and allows them to stay healthy. And I think if we focus entirely on that contribution of this plan, then it will make a dramatic difference to the well-being and the lives of human beings.
For more information on the National Prescription Drug Plan, visit nibdrugplan.com or call 356-2070.